Welcome to the second episode of the Therapy Insights Resource Roadmap Show. We are going to talk about some of the resources in our Access Pass library today in different ways. If you're a member, you have instant access to all the resources that we're discussing today. If you have the printables feature included, and if you're not a member, you can easily go to our website and sign up today. And if you are listening in on a podcast or watching on YouTube and you want CEU credit, just go to our website, therapyinsights.com, go to CEUs, find the Pediatric SLP Resource Roadmap Show form and fill that out to get your certificate of completion. I'm your host, Bailey, and we have our writers here today, Heidi and Tasanya. Welcome.
Thank you.
And Megan is in the background pulling up our resources to display on the screen. And we need to verbalize some disclosures. We're all being paid to run the show, and we're also discussing Therapy Insights products today. So we have an exciting collection of resources for this month. We have lots of variety of topics, everything from assessment of pediatric brain injury to articulation to auditory processing. So I'm excited to talk about all those today. Let's jump right in. So first, we have Articulation Egg Hunt Minimal Pairs card. So this is a 10-page resource with lots of beautiful pictures and the words that go with the pictures. So Tasanya, you created this resource. Can you tell us more about it?
Sure. So this resource is for families or therapists who are working with children who need some help on either being able to distinguish between two sounds that can make two similar sounding words different, or for children who need to work on reorganizing their repertoire of phonemes or sounds. So for this activity, the way I would use it is I would cut out the pairs and I would put them into a plastic egg, and I would make an activity of searching for the eggs. So some children benefit from like busy work in between the activities. So if you have a child who benefits from gross motor activities along with the communication activities, this is really good for them. So I'd approach it two ways. I'd either have them search for the word, search for the egg, and then when they find the egg, we would work on pronouncing it then, or have them search for all the eggs that you've hidden. And then in the end, you sit down together and you go over the words. So that's really based on the child and you knowing what their performance levels are and what their needs are. If they do better with very structured tasks, then you collect all the eggs and then you sit down in the end and you go over it. If they benefit from a little bit more of a free-styled session, I would go over each word as I find it. So when going over the words, if the child is new to the whole concept of minimal pairs, I would pronounce the words first for them to give them that model. If they need to have the teaching aspect first, if they benefit from some verbal cues, visual cues, I'd pronounce it first. And then I'd have them either repeat after me or take a shot at pronouncing it on their own. And as they progress with their ability to do so, then I'd have them work on doing it at short phrase level, then sentence level, and then we can carry it over to conversational level task. If I wanted to work on increasing their awareness, I would intentionally pronounce the words wrong. So for example, I would say, if I was doing it at sentence level, I'd say, I was the fastest runner, so I won the race. And see if the child is able to identify the fact that I said lace instead of race. If I wanted to work on their articulatory precision, I'd do some work on having them repeat the sound and working on the L phoneme versus the R phoneme, for example. So this is pretty much how I would use these cards.
Awesome. I love the real photographs. We talked about that last month. I just love that context. And also, I think this is so versatile because I look at this and I see a lot of language opportunities also. So tying in articulation in language. Yeah, this is great.
I was just going to say the same thing. Like, I know, like each month when we go to write or think of content, it's like, it comes out a certain month, so you kind of sometimes theme it with the month. But this, if you're just listening, this would work for so many things. It's not like all the pictures are for springtime or something. And I think even like you just said, Bailey, that you could use it even, you know, for, it has the words written, but it also has the picture. So you could have it for multiple age groups and targeting different things. Like I would love to have a set, well, I will I'll print these and use them, but like to have the child come up with like a third one that could fit in the group or something like that. It's just an easy resource to extend, and it's just not stale like so many articulation flashcard type of activity. Like the pictures are weird or they're just not that interesting. So I really like that this one, you know, most kids should recognize a lot of these things because they're updated, they're not old.
Totally. And they're
So
interesting to look at. Go
Go
ahead.
ahead. Okay, I'll go. I love to laminate as well. I think we're all laminating ladies here. So if I didn't want to do the eggs with it, I definitely laminate it and make another game out of it too, focused on the awareness aspect of it. So, and I'd still use the way that it's laid out right now. So I'd probably have like rake and lay, and lake and ray together, and have them identify the words that sound similar, and then tell me what makes them different, you know, and working on their awareness for minimal peers.
I think a resource like this is also really good for new, like more novice clinicians or right out of school, because it lays it, like you're saying, the way the pages print, there are similar types of words together with different positions that are similar, voicing, all those different things. So it really would help you not feel like you're having to make that up or think of it on your own. And the more you look at, the more I'm sitting here looking at them, the more patterns I'm seeing you could target. So that's a really neat way, kind of like you're saying, to have this just be one of your like tools that you just have laminated in a folder or at your desk that like really you could use probably from any kid working on articulation, minus a few, but it's really helpful that way. I think that it's very use on your feet, which is a skill you just don't, that's what you've got to learn when you're starting out as a clinician. It's like, how do I make this last longer? How do I use it for more than one thing, so I don't feel like more than one client, so you're not spending too much time building and crafting things.
Being adaptable.
Yes.
Yeah, Heidi, that's so true. And I think like when you buy a therapy material, you want it to be, have multiple uses and not just for one narrow sort of session. So yeah, and there's lots of good variety of words here too, which is great. Awesome. Let's move on to the next resource. Oh, before we do that, I want to talk about the article snapshot that one of our writers, Kate Hawkins, wrote this month. And we're talking about it now because it directly relates to Tanya's resource. It also reminded me of the discussion we had about R last month. So the research article that Kate wrote about it's a tutorial, and it's called Using Visual-Acoustic Biofeedback for Speech Sound Training. And it was written this year, so it's new research. And the authors essentially gathered research from the past 10 years and kind of put it all together. I thought that was really cool. And I'm going to use the acronym VAB, VAB, just for sake of brevity, for visual acoustic biofeedback. So they basically found that using VAB is another helpful modality to support students with speech sound disorders who may not respond well to more traditional therapy practices. And this is specifically with R. And as we talked about last time, we can all probably agree that R is the most challenging sound to work on. You can't see it. So this is just a nice tool, I think, to use so that the child can actually see the movement. The article mentioned an app called Start, and the R is capitalized. It's by Bits Lab. And I actually tried to download it on my computer, but it's more compatible for iPad. And my iPad is so old, I just couldn't get it. So, but the article did have like a screenshot of the app, and it looks really neat. It looks engaging, user-friendly, but it uses biofeedback for R with pictures and such. So the authors also said that it's important to select an appropriate target for each child to try and match. The same template should not be used for all children because formant frequencies are impacted by vocal tract size, which makes total sense. And they also said that when possible, the clinician should reference the LPC spectrum. So LPC is linear predictive coding. And I definitely had to do my research on that because I haven't had acoustics in a long time. But it makes sense. It's just kind of a dynamic analysis of speech that gives you this visual representation while suggesting an articulator placement cue. So to finish that thought, put that all together, the example they gave is try moving your tongue back and watch what happens to the wave. So the clinician and client are sitting there. The clinician gives that verbal prompt and they're both watching the wave as the child is producing the R sound. Similar to more traditional speech sound interventions, the use of structured practice schedule and appropriate feedback are keys for success and utilization of VAB for sound acquisition and generalization learning. So to add to that, the authors mentioned that there isn't like an agreed upon consensus of like how many trials to do in a session with this, but they did say 150 trials is what you should aim for. So pretty intensive, I thought, which is pretty common for articulation. But I thought I've always been interested in like ultrasound and VAB with R production specifically. I've never had hands-on experience. I've never really seen it, but I'm glad it's being studied. And from the article, I think it's been studied for several decades now. So technology is obviously improving. And I think it could be a great tool to use just for kids that pesky R that this might not respond to traditional therapy practices. So the study did show that VAB can be effective for that. Heidi and Tasanya, have you ever seen VAB or ultrasound for R?
No, I'm really
No.
curious. Like you said, it's I've heard about it. I heard about it in grad school. Like I knew it existed, but it didn't seem practical unless you worked in like certain places that had this machine. So if you're talking about it somehow being able to convert to an app, like how helpful that would be. Kids love technology. I mean, that's not hard to get buy-in on technology from most kids. And like you're saying, and like I think this article talks about, it is actually pretty impactful. I mean, it can really turn the corner for some kids. So, but it was always like, well, I don't have one of those machines like in the closet at school to be like holding. And so that's, maybe this is an exciting kind of start to a new era with that, where it kind of moves out of the research realm into practical, easy use, which would be awesome.
Yeah, I agree with Heidi. I haven't really seen it outside of research, you know, like in doctoral program and stuff, reading up on it, but I've never seen it in practice.
Yeah, and like you were saying, Heidi, like I guess in my mind I have this ultrasound machine and it's connected and it's cumbersome, and the article did mention that, and I think this VAB specifically, the acoustic piece, is what kind of sticks out and what's the newer technology. So it's not just the visual, but it's interesting too. It sounds like a little training would have to be done because the authors emphasize like the clinician and the client need to understand what they're looking at and understand that visual representation of the sound. So a little bit of legwork, I guess, up front, but I think, like you said, it could be super useful. And it seems like the app is a great start for that. So thank you all for your input on that. Let's move on. So our next resource is Self-Sufficient Teens, Executive Functioning Tasks Targeting Care Plans, Medication Management, and Self-Regulation. This is a 2-page resource, and the first has just some info on it, and then the second page has a nice chart. And Heidi, you wrote this, so can you tell us more about it?
Yeah, so kind of the idea, like when our subscribers vote or send ideas of things that they're interested in, we get a lot asking for the older kid, you know, teenagers, not everything for babies or little ones. So that's kind of how this came to be. And executive functioning, I think, you know, this is helpful for any teenager probably on some level, because I don't know that anymore with all of the apps and tech, we're just talking about the benefits of technology. Kind of the flip side of that is it almost seems like it's easier to be organized and remember everything because you can put it in your phone, or your mom or dad or grandma can text and remind you to do things. So this resource kind of is to give just an easy basic level activity, like to start from the beginning of how would I think through my day and things that I need. And this one is more tailored to those like maybe medical tasks or appointments, things that aren't, it's not really geared for school. It's kind of those things like going to school would be one of your activities I was envisioning for this, the chart that's on the second page, but it's more those other tasks that make your day different maybe than the kid next to you. So kind of, I did a how-to guide so that it didn't feel like you were just starting from square one. Sorry. So kind of sitting with your client and brainstorming and seeing where their understanding is of like, what are the parts of your day? Because I think a lot of times with this population, because they're closer to an adult age, you assume they're thinking through all of these things, but they maybe aren't. Like, what do you have to do in a day? Okay, so kind of listing those with them. And that's things like medications or therapy appointments, or, you know, it could be picking up a sibling somewhere, things like that. Then the other kind of giving the next level is working through the worksheet or this list that you create and label like needs versus wants. I think sometimes, again, we might assume that a teenager would have that higher level reasoning to think I need this versus I just want to do this. Like I want to go to the skate park after school. That's not, maybe that is actually a need for them because they've been cooped up all day. So kind of starting and having those discussions so you get a better idea of where their functioning level is, because I think that is hard with teenagers and kids in general. You know, we assume we know or whatever. And again, being able to have kind of that more adult conversation of like want activities versus need. Then the goal kind of the whole, the graph has the different, it says the time of day, it has the task, the steps, and then if you like a checkbox for completion. So I think that's really helpful to think through. So that's what you're trying to get them. Then once you have the list of things to say, okay, well, is there a time attached to that? What is the task you need? What are the steps? And again, that's kind of going into more of a behavior, like what are big steps you need to complete that task? And then, you know, a checkbox at what time you did it. And then you can also, this is obviously something they should do as well with their parents or caregivers at home. And over time or throughout the activity, you should, you know, the first task I have here. So at 8 o'clock, I need to take my Adderall. So I need to let my mom know that I need it out of the out of the cabinet. I get and then I need to make sure that I drink a glass of water or I eat a small snack. And then it was by 8:15, I was done. So that's the example I provide there for you guys to see what I'm kind of thinking in my head. And again, the goal is not for a kid to need to do this every day or all the time. It's saying that hopefully once you've sat down and broken this task or a day down, it doesn't feel so overwhelming. And then some of these things move from like I need a constant reminder to do it to like, that's just part of my routine. And I can sort of think through this hierarchy of needs and wants on my own. That would be sort of where you would get to them accomplishing the goal that you might have set for them over the course of using this resource. So it would be something you worked through pretty intently, like the first couple of sessions. And then as you go, you're kind of more looking for the feedback from them. Like, are you using this still, or is it, you kind of don't need it anymore? Or you add it, you know, can we add other things to it to help you? And the goal, we made it really visually pleasing. It's not, you know, it's got some little graphics on it. So you could definitely hang it up somewhere, you know, on the fridge or maybe in their, somebody's, you know, their bathroom or in their personal space, but where other people can see it and it's functional. I think sometimes checklists or these types of activities, we do in isolation with patients and clients, and then it feels like, okay, well, I just did that assignment and now I put it in the trash. So like trying to make a conscious effort to put it somewhere that they would use it, but it doesn't feel like a baby's schedule or something, I guess is what we were trying to avoid. So anyways, I mean, the goal, again, at the end here, it kind of says on the first page of instructions, it says, seeing if they can plan out another day by themselves, like that would be their homework assignment, or a week, you know, you could level this up or down as you wanted to.
That's awesome, Heidi. Yeah, I like how it's laid out. It's just very simple. And I love how you put the guide on the front page. And it just gives a good starting point. And I like that you can just reuse it over and over, and it's something that can be long lasting. And I mean, I find myself making lists with the time and like just for myself to function as an adult. But yeah, this is great.
You know, Heidi, I really like this. I can think of certain populations of students who can use it, especially, I don't know about other regions, but in New York, many of the schools are giving the students planners, and some of them don't know how to use it either because they're not using it efficiently, sometimes because they may have like ADHD, or they may have other components that contributes to them having difficulty with organization. So I would definitely use this to teach them how to use those planners so they're more productive in their day. Some of them have to document their assignments in it, and they're not successful with it. So I would use this, I would laminate it and see, I'm always laminating something. I would laminate it and use a dry erase marker and, you know, go over it a few times with them to show them how to actually use this. I really like it.
I did think of those planners when I was making this, because I can't believe they still give them out, and they're so overwhelming. Like when I was in the high schools, no one knew what I mean, it was like, I guess I'll write my homework here. Does that help me? It didn't, there wasn't a lot of teaching time around it. And so for those students that are struggling with those skills, it was kind of where I was like, what would I do differently if I was handing those planners out again? It was like, I'd probably have a whole little lesson about how to use it.
Yeah, I think the simpler, the better.
For sure. And they're starting young. They have them from like elementary school.
Oh, okay.
Yeah, I think like I've seen like third graders with it. So I think this is really good to help them learn how to use it effectively.
All right, let's move on to the next resource. This is called Auditory Processing and Language Development. This is a nice one-page resource with lots of great info divided into different paragraphs, different subtitles. Tasania, you were the author of this. Can you talk more about it, please?
Sure. So with auditory processing, sometimes what caregivers say is that, James is just not listening. No matter what I do, he's not listening. And hearing was tested, and the doctor said hearing was totally fine, but he's just not hearing. And as professionals, we may be able to identify that there is an auditory processing component, but it's just not diagnosed yet. So I might use this when helping a family to seek services to have their child assess auditory processing, or to help them to understand what to expect and how to help their child to continue to develop their language while they're either going through the assessment process or even after a diagnosis, just helping them with some strategies so they can continue to be successful in an academic setting and even in social settings. So I'd also print this out and I'd give it to anyone who's involved in the academic setting with teaching the child or being around the child. So whether it's a teacher, it might be a special education instructor, a para, the physical education teacher, anyone who's involved with that child's academic day and helping them to have a more successful day. So for example, it talks about how skill therapy can help a child who has auditory processing disorder. It talks about assistive technologies such as FM systems and how those can help with either amplifying sounds or with helping them to tune out sounds that may be causing more distractions or difficulty with the academic day. Also, strategies to adapt the environment so that the child is able to be more successful in the classroom with learning, and also self-advocacy. And self-advocacy is really important because some children become, there's a component of learned helplessness And I feel like if we are able to give families and individuals who are experiencing these things techniques to help them to advocate for themselves, they can become more successful in the academic setting. So there's some strategies here for self-advocacy. Yeah, so again, I just either hand it out to caregivers, I bring it to the school setting, I give it to other family members who the child may be around. Sometimes we have grandparents or babysitters who care for them after school and they're working with them on homework. And here's some strategies that you can keep in mind when you're working with Sarah on her homework. Yeah, that's how I use it.
This is like, I just feel like there's so much we want to share with everybody. Like, I feel like, yeah. And I think this reminds me of, we were talking last month about fluency, and just this kind of helps like bridge the gap from, you know, therapy to all the other people that the child interacts with, and just advocating for them and giving those people the information so they can kind of modify how they, you know, interact with the child. Yeah, this is great info. I like how you divided it into sections like the skilled therapy, assistive technology, adaptations, and then self-advocacy. Like that's very nicely outlined there.
Thanks.
What's
Great.
your all's experience? Like, I remember very distinctly in grad school many years ago that they were, you know, there were two camps about auditory processing. It was very strange. I was like, I mean, I was in school, so I didn't really, and I hadn't been out in the field like seeing the kids. I mean, I'd worked with kids prior to that. And I just think this is a nice resource to, like, it's non-controversial. It's just pointing out strategies. Like, it doesn't, you know, it doesn't peg on whether you believe it's a real thing or not. It's just saying, like, these are strategies that people could use. Therapy could help them. And yes, same. I mean, I think it doesn't matter whether somebody believed that diagnosis was a truly medical diagnosis or not, whether the child should advocate for themselves. So I think that it's not, and I know when you look out in the literature and in like resource areas, things for auditory processing can be hard to find, or they're very narrow and maybe a little bit agenda driven. This is not like that. It's sort of just like, this is what's going on, you know, take these strategies if you want them. It doesn't kind of blame or go one way or the other. I don't know if you guys have any comments on that. It's I don't know where it kind of sits now in the community, but
Yeah, I don't, Tasania, I don't know what your thoughts are. I was going to say the same thing, Heidi. I was going to bring that up. Like, I get that icky stomach feeling when I hear auditory processing, because I've been like told it's not real. But then there have been other settings I've worked in where like we had an auditory processing test, like a valid test, and clients on our caseload with that. And we had certain treatments that we would do for them. So it is confusing and it's not clear. I think in grad school I was told like it's not a thing, it's not a real diagnosis, it's made up. So I don't know what currently is going on with that.
Wow, I don't know. You know, we're gonna come to this topic several times, like with our field, and how there's always this debate on what's real and what's not real, and which technique we should do and what we shouldn't do. And it's like, make up your mind already. But I really think for the most part, like our field is so driven by research, and if there isn't a healthy body or a large body of research on it, you're gonna have half or a quarter of the population of specialists, I would say, it's non-existent. And then you'll have the other half who are like clinical and dealing with it. And you're like, it does exist, but the clinical half is not doing the research. And the half that's doing the research is doing it in like a very isolated laboratory setting. So we're always going to have this debate. Whether it's real or not, I know people who specialize in just auditory processing. And I've seen children who are treated for it and they make progress. So I don't know if maybe the treatment they're receiving is treating something else and they're just making progress. I don't know. I can't answer the question. But I do know that I do know several people, you know, around the US who specialize in this. And I have seen some children who present with like these characteristics of auditory processing disorder. And when they have, you know, when they receive the the treatment that's out there for it, they do make progress, you know, or that you do see some type of changes when they're, for example, if they use assistive technology, you see some progress. If they have those adaptations, they might, in their environment, you might see some performance progress. But I just think there's so much things within our field that are always going to be debatable. And it's largely because we don't have our research is still growing, and we have a lot of amazing clinicians who are dealing with working with these things, and they just have no interest in doing research. And then we have a large body of amazing researchers who are not interested in being clinicians, and there's like no in between. So I feel like we're always going to have these gaps until our research develops. Maybe when our little ones are at our stage in life, they may have the answer to that. Maybe they might say, yeah, they may have a different answer to that.
Yeah, maybe more people get into SLP and develop that even more.
Yeah,
That's a good, this is a good talk. I mean, definitely could probably have a whole episode just on auditory processing. So
yeah. I mean, some people feel like ASD, like autism, doesn't exist. They're like, it's not a real thing. It's like there's all these debates on it, you know. I feel like there's always going to be a position on it because people will always say it's something else. It's not this, it's that, but it just looks like it, you know.
Right. It's always extreme.
Yeah.
Yes, good comments. Let's go on to the next resource. So this is Comprehensive Assessment Tools for Pediatric Traumatic Brain Injury. This is a 4-page resource. The first 2 pages have a lot of great info and text and just information to kind of set you up for the last pages, which are, there's a data tracking chart, and then there's a parent caregiver questionnaire. Heidi, you wrote this. Tell us more.
Okay, well, this is definitely created from my own practice, not feeling like I had a lot of resources for pediatric TBIs. Also, a lot of reader feedback or subscriber feedback that they wanted more because there isn't a lot. So the goal of this whole 4-page thing, this resource, is to think through, like, what is a comprehensive assessment tool, or what does a comprehensive assessment include? Because you don't always have a standardized option where you practice or where you, every child with a TBI is going to be extremely different, and you definitely don't need to dig into all of these 8 or so areas I go through to have a comprehensive assessment. But this is trying to say, okay, how can I have somebody come in and feel like I have different tools available to me to assess them and then measure their progress so that I know if we're making progress or not. So it kind of talks, there are a handful. So I will say there are a couple, and it lists the standardized assessment tools here. There's the pediatric test of brain injury, and that's the one I'm most familiar with. I've used that in a couple settings now. There's the behavioral rating index of executive function, the student functional assessment of verbal reasoning and executive functioning, and the test of everyday attention, which I think that those aren't all specific to pediatrics either. So you are looking at that discrepancy of, like, this isn't really designed for kids, but it's the best we've got, so we're going to use it. Again, my experience is they can take a long time. All kids with brain injuries, probably, like, attention span is an issue. So to be able to get an accurate assessment from these long standardized tests became prohibitive in my practice. So that's where I kind of dug into the next, how this resource plays out. So there's also a validity and a need to, and I didn't think about it when I was first starting out, but having parents or caregivers fill out something that describes what their behavior is from an outside perspective. So that's definitely a piece you want. So if you can, you do a standardized assessment. But no matter whether you do or don't, it kind of walks you through how you should do some sort of parent or caregiver questionnaire. And it lists a free one that you can just download kind of off the internet if you have access. It's called the Family Needs Questionnaire, the pediatric version. So that's something, I mean, we don't put those on our website, but that gives you the name. So in theory, you could go out and locate that yourself. So if you did all these standard assessments, kind of look at the goals and target areas, like what subtests they struggled the most on. And then kind of my goal was to think, okay, how do we take all that information and put it into a clinical practice? So selecting their 3 to 4 highest needs areas, where did their scores come back the lowest on those assessments, and discuss the challenges in the home or school setting so that you can think through what are reasonable goals you could set that aren't abstract or just arbitrary based on like, I want them to say 5 numbers in a row back to me. That's not, how would you write that to say something more meaningful? Like they could tell me, you know, remember mom's phone number in case they lost their cell phone or something useful like that. And then the goal of the resource then is you create 4 non-standardized kind of assessment items that you can use weekly, or say you didn't have any of the standard assessment options, you could just make these yourself and go forth and measure and treat using those, the information you got. And the big thing for me is functionality. So the next page 2 of the resource starts with a little flow sheet. So it gives you a spot you can think through what is the standardized assessment results that you got. You don't have to write it verbatim or by numbers, but just like did poorly in these 3 areas. The other right below that, it's saying, what are 3 challenges that the child or their family has identified in the home environment? So you kind of put them there, you think through, and then below there are the like 10 or 11 areas that could be impacted by TBI. Not, those should be mostly inclusive, but maybe there could be others. And picking just 2 or 3 of those and then creating a task that's going to measure that. So the areas we go through and give you ideas on are orientation, kind of, that would be pretty extreme if they're still, if you're seeing them in an outpatient setting, but if you're in an inpatient setting, making sure they can orient to the environment, person, place, time, following commands, naming, kind of like that longer, the memory task of like, okay, say, can you list 10 words that start with the letter M and how long it takes them, or give them 1 minute, see how many they do. Word fluency, that's, I've kind of given that, I skipped the morph 2 together. So naming would just be categories like name 10 foods or whatever. And then word fluency is that time piece. Then convergent and divergent tasks, which are always hard for me sometimes on the fly to remember which one goes which way and all those things. So this kind of lays out some of the examples of those types of activities. And all of these tasks, in theory, you could just use an everyday activity as well. It's not something you're sitting making up. It's just, oh, play that game or do that activity, and then you're going to be able to assess this area. So divergent task, it's more create a story and share it with me, or plan, it's those open-ended tasks. Can they do all the pieces they would need to plan a party or a meal or make a menu at a restaurant? And then also like the providing multiple stimuli, and then which one doesn't go here. So that's a good measure assessment tool for divergent tasks. Digital recall or digit recall, we talked about that already. That immediate retelling, so short-term memory, and then the delayed, like at the end of the session, I'm going to also ask you these things. And then picture recall can, for kids that don't read, that might be a better option, is like, I'm going to show you a picture, we're going to draw it together, and then at the end of the session, I'm going to take it away, you know, you'll have it taken away and see if they can draw it or recreate it. And then the 4 areas of attention. So this resource was overwhelming to create, I think, for me, because I was trying to capture a lot. So maybe thinking of it as like a starting, like a general intro level, if you're thinking about whether it would be useful to you, it's kind of helping you think through how to get that repertoire of tasks that you could have to easily pull if you had a kid come in for an assessment, or if you're treating them actively. How do we work through the different areas that we would think could be impacted if they had a TBI? And then you just engage in those tasks as they come to their sessions each week, or however often they're coming. Make sure you're providing some sort of carryover to home that parents can report back to you how it went, or their caregiver or their teacher. Obviously, always employing that principle of gradual release. So hopefully each week they're doing more and more on their own or getting better. And then generalization is a big piece for these patients because it's hard to capture them making progress, and you can't just have them sit on your caseload for indefinite periods of time and everyone kind of feels like, are we getting anywhere? Then there's a data tracking sheet, that's page 3. So it just gives you, you can write like 4 dates, what activity you were doing, and then the completion time and their accuracy, which are really often the main things you want to measure with TBI. And then you adjust your tasks as needed and kind of work through their different challenge areas. And then, as I mentioned earlier, there is a standardized family needs questionnaire, but I did provide one at the end of the page 4 is like a 6 question. If you don't have access to that, or you just want to print this resource and go, you kind of have all the big pieces and you still have to do some legwork on your own. But I think the goal was to help you conceptualize the whole treatment and care plan for someone that's coming in exclusively with like a TBI with their kid. So
thanks, Heidi. It's such a robust resource. Lots of great details. It's not a case I would usually see where I work, but super interesting and good to have in our toolbox. I don't know, Tasanya, if you see a lot of TBI.
Yes, Heidi, this is brilliant. I had to grab my pen to write some things. Like, it's so true that there aren't really many batteries that are PEDS friendly. So, you know, you have your CLQT, and now you have your, what's this, the CATPT. You have your comprehensive assessment tool for pediatric TBI. But seriously, and I like how you always create these really cute graphs, the way you lay it out. But I can totally see a lot of interns who are doing their external practicums or even fellows using this tool to assess some of their patients. And the questionnaire is what I really like as well. That way you can get some insight from the caregiver as well, because we don't always get what we're looking for at that one moment in time when we're doing the assessment, especially in the hospital setting, when you can't always like a full battery. Sometimes just the intake form from the caregiver or from the patient is what gives you the meat of what you're looking for. So I really, really, really like this. I really do.
This one took me many resources we have written. This was one of the, I wasn't losing sleep over it, but I was thinking about how to make this useful because it's so, you know, so maybe we should call it like part 1 with more build out to come, because I'm even reading it now like, oh, I should have, but that's how little, like you're saying, Tanya, that there's just not a lot, and it's not practical for kids. It's not helpful for therapists, and it feels so rigid, I guess, is, you know, it's like, okay, cool, we can list numbers and you can name a bunch of stuff, but okay, let's just use that as the task to measure your progress, but also what could we find, what else could we do that actually is something you do in your life where you need that skill, and that's where the breakdown is occurring. So, you know, yeah, maybe we'll call this part 1. I already know more I want to do with it, but
you should definitely take this somewhere. And the other thing is, like, to be realistic, in the hospital setting, we don't really do like a full battery because it's kind of almost pointless to do it, or not pointless. I don't want people to attack me, but you can't always complete it. But the good thing about it is when we do a battery is because we're trying to create goals for the patient. And that's why I really love this, because what you're really doing here is creating goals. You're creating goals for the patient, for the child. So I really, really like this.
Thank you.
Yeah, it's such a complex thing that you're assessing. I mean, like you said, part 1. And Tasanya, what you said about the parent caregiver questionnaire and just the background and history, sometimes that's all you can get out of an eval. I've been there many times, and not just with TBI, with other areas, but yeah, that's a great point too. Awesome resource. Okay, let's move on to our last resource. Heidi, this is you again. This one is titled Homework. Oh, I'm sorry, Tasanya. Is that
no, Heidi.
Heidi.
Yes. It's written wrong on the screen.
Yeah.
Oh, okay. So it's titled Homework Planner Organizational Chart for Pediatric Patients to Support Executive Functioning. I love all this executive functioning. This is awesome. So it's a 3-page resource, and we have some nice charts. There's a homework helper table on the 2nd page and a project mapping table on the last page or the first page gives some nice examples of how to use those. So Heidi, tell us more.
Well, it's nice that this one, obviously I had a theme this month that I ran with, but I think there's just not a lot to use that's easy for clinicians to just take and go, or to give to kids or their families to work on these things. So this one is more, probably could be used with any age kid, but it's more school based. I mean, it's for your homework planning and organizing those things. So the helper table has the subject in class, the assignment title, due date, and then I wanted them to have to think through, like, is this a short-term project or a long-term project? Like, because I think that's a skill a lot of kids miss. That when you're talking about, we've had this theme today of like the planners. I don't think a lot of kids, it's like, I'm going to write it once, but it's like, maybe that needs to be written every day for 5 days because I need to be doing it every day. And then kind of getting that executive functioning there of like, how much time do you think it's going to take you to do this? And that you really would encourage them to be honest with themselves and say, you know, if they think it's going to take 10 minutes, let them write 10 minutes there. And then if they go home and realize it's 30, that's a conversation to have, you know, like, hey, why did you think it would take less time, you know, to kind of get them to have that deeper self-awareness of their own ability. Their daily progress, so the dates they completed it, or I worked on it for 10 minutes and got tired, they could also write that in. And then my favorite thing when I was a special ed teacher was, I did the assignment, but I don't know where I put it. So there's one of the columns is to say, where did I put it? So the example here is I put it in my binder in the social studies section. So again, the goal is not for any kid to use this every day for months on end. It's that, let's go back to the beginning, because we assume a child can do this, or we assume they understand these things, and maybe they don't. Elementary school, I mean, obviously this isn't really a fit for younger kids, but like K-3 this is probably too much for them, but older than that should be able to handle it. And then I have the third page in the resource, if you print it out, is more for those tests and project mapping, because that is a different plan than your daily homework. So it kind of shows you, okay, so the example is I have a math test on triangles. The next column says due dates or test date and the days to go. So March 4th, 2023, I have 15 days left. And then kind of having them write that plan of action. I think studying is such an abstract concept. I can't even imagine, honestly, trying to study if I had a laptop as a kid. You know, if that was one of my main resources to be looking at content from school, that would be really difficult for me. So this kind of takes away, they don't need any of that stuff to fill this out. But so if we're doing a math test on triangles, it would be, okay, I need to review my equilateral triangles, my isosceles, my obtuse. There's probably more. This was my basic example. And then some ideas, like I could do practice problems from my textbook, or I could have a study group with friends to go over the problems together. So again, trying to get them to think through those task analysis. What would I need to do to get to this bigger goal? And then the fourth column for the project and test is saying, what are successes and growth areas? Because I think that is something we could spend more time with our older clients working on with that. Like, what you gotta tell me what you're doing good. You know, more positive feedback often leads to better outcomes anyway, but they need to do that for themselves as well, especially, not to veer off into some other topic, but you know, teens are really struggling right now from a mental health perspective. So teaching them like how to identify things they're good at. And instead of saying failures or I need to get better, what are areas you can grow in? Because it's sort of planting that seed that you can improve this, you can do it better. So what are those things we need to do? So just the example I gave, I'm getting all the questions right about my equilateral triangles. I feel good about those. And then having that conversation, okay, well, that means you probably don't need to study those as much anymore. And then another one here, example, I'm finishing the problems in less than 5 minutes each, so I should be able to finish the test in a class period. I'm struggling with the isosceles triangles, so I should probably review those more. And again, they don't have to write every single thing out about each of these activities, but I think this just gives us as the clinician a way to start, somewhere to start that breaks these tasks down and helps us see where they're falling apart, because that's always as we talked with the resource I talked about first today, the executive functioning tasks sheet. It's hard sometimes to figure out in these higher level tasks where it's falling apart. So hopefully through using either of these charts, you get a better idea, and then you can help jump in right there. Obviously, gradual release, another theme of my month making these. Sometimes these tables or these categories aren't going to work for every child. So how could they even make their own? Like, what do you need to have written out to be successful? Again, not just for homework. This could be for any, say they're applying to summer jobs or doing something like that. You could use this as well. You can also add that task completion check-in if you needed to. The other thing I think with these types of activities that I've seen myself falling apart, I guess, when I was trying to work through them with a child, is the planning process, when it's an independent skill for the child, should not take longer than the tasks you're putting into the table. You don't want this disconnect of like, oh, I'm going to spend 25 minutes filling out my planner, leaving me only 10 minutes to actually work on my review problems. I think that is something I used to get caught in a lot more. Without that awareness of like, wow, I did this activity, but I didn't really, that's not going to be functional for them if it's still taking them 20 minutes to fill it out. So just being aware of that, and kind of thinking back to those physical planners or just the way things are structured today. It's like, you don't need to be getting fancy with a bunch of colors, descriptions, or the table filling in process. This is supposed to be a big picture task that we've given some guidelines and exemplars here, but that might not be what works for you. But again, your goal from using this resource is to target where are things falling apart for them. Is it their time management, their long-term planning skill, their organization of like where things go, or they can't see that they're doing anything right or doing everything wrong. So anyways, yeah, I really like how our graphic designer, it's really approachable. It doesn't feel boring and stuffy either. It's light colored and cute. So.
Agreed. Yeah, very engaging. This is awesome, Heidi. We are a little short on time, y'all, so let's move on. We are going to talk about our case study. So every month we like to make a case study, and this gives us a way to talk about other resources in our library, and also just a way to talk about potential cases we might run into and talk about it from different clinical perspectives, different angles. So the case study for this month, Megan, if you could pull that up, please. Thank you. So I'll read it. A 5-year-old male given a recent diagnosis of autism spectrum disorder from a child psychologist who recommended comprehensive evaluations for all services, OT, PT, speech, and feeding. Child is non-speaking and primarily uses signs, gestures, body language, and grunts to communicate. The child psychologist who evaluated him also recommended applied behavioral analysis, or ABA therapy, due to self-harm behaviors. His parents are hesitant about this particular therapeutic approach. They feel this will create anxiety in their child based on anecdotes from other parents, but they are open to learning more about this type of treatment. So the three of us picked out resources from our library that would relate to this potential case. I chose, Megan, I think the first one is what I chose. Yes, so I chose this handout. It's called Roles on an Interdisciplinary Team Supporting Patients on the Autism Spectrum. So I like this handout because it's just a nice reference for parents, caregivers, and family to go back to if maybe they, and I don't want to speak out of turn, maybe if they feel overwhelmed by this new diagnosis and there's all these professionals that their child interacts with, they have different services, and it's just sometimes a lot to keep up with, I would think. At least I've seen that in my experience. So I like how the handout, it discusses potential professionals on the child's team and what those professionals do. So SLP, OT, pediatrician, et cetera. So the parents can kind of keep track, okay, my kid is seeing this person and they're doing this, and this is why they're seeing this person and what they're doing, how they're helping my child. So I like this as just a reference for them to go back to. Megan, what's on the next slide? Is that, I think, to Sonia, you had a few resources that relate.
Yeah, I think I wrote all the rest of our that we have from the archives, but because it's a topic that autism is a topic that everyone has an opinion about, but not many answers to. So I just feel like it's good to have like a lot of resources for family, and they're all written in a manner like as a handout for the most part to help to minimize burnout that caregivers get when working with your children who have these diagnoses. So in order to care for someone else, you have to be able to care for yourself. You have to be in a good mental, physical, emotional state too, because you don't want to take out any negative feelings that you may have on the child who's not intentionally carrying out behaviors that may come along with a diagnosis, such as the self-inflicted behaviors that I mentioned in the case study, for example. So this is why I picked this one. You can go to the other one. Oh, go ahead.
Yeah, so this one, just to kind of give you a visual for those listening in, it's a 2-page resource called Management of Caregiver Burnout with some really nice strategies and then tips. And then the second page has those strategies listed out, easy to read. But yeah, go on to the next one for sure.
I know we're short on time. The other one is called Routines to Implement into the Academic Day for Children with ADHD. And even though our case study is a child diagnosed with autism, sometimes some of the experiences between autism and ADHD are similar. They're totally different diagnoses, totally different experiences, but sometimes as caregivers, you may experience similar situations. So this one, for example, it lists ways that you can identify your child's strengths and weaknesses, creating a plan to help your child to deal with and identify those challenges, building their self-esteem. Always about advocating and building self-esteem, taking breaks to help them to have a successful day, creating incentives, bedtime routine, and managing your child's nutrition. And we can go on to the other one. I know we're short on time. So the reason why I picked this one is called Including Pet Therapy into Expressive Language Goals for American Sign Language Communicators. This is one that I had written specific for ASL communicators because it's not much for that population. But the reason why I think it's good for this case is because the child uses signs based on what the family mentioned. And sometimes the reason why children with ASD they have these quote unquote outbursts or these behaviors where they're inflicting pain on themselves, or where they're carrying out what's believed to be dangerous behaviors, is because they can't communicate. So if the child is communicating, we want to help the family to learn how to continue to communicate via this method of communication, which is signing for the child. It didn't specify if the family was using ASL or if it was baby sign or if it was just gestures. However, it's just a resource that this family could use to continue to nurture that child's specific method of communication, along with whatever other methods they're trying to work on developing. I think the others are Heidi's going to present.
That's such a unique resource. I love that. Heidi, yours is Positive Parenting Strategies for Parents of Children with Developmental Delays.
Yeah, definitely. Like we said, that case study was kind of overwhelming for parents, so I picked this one. It's just a 1-page handout, again, just to support those parents. And it says strategies with developmental delays, but again, good parenting or good strategies. It's not diagnosis specific. And again, I find so many parents are overwhelmed by these diagnoses, and it feels so negative that this one is really saying, like, your child does have strengths. Like, here's what you do have in your control is how you interact with them. You maybe can't control how many specialists they're going to need or all the things that are coming up next. But it says, identify the root behavior, communicate with your child, model target behaviors, positive discipline, and celebrate and reward. And again, this is a great just like overview of a starting point. So parents could feel like, okay, I have something I can do now to help this.
Mm-hmm. Yeah.
So the other one is, this one is another just 1-page handout. Really, like, I think the resources are for the parent at this current stage, because you can't speed everything up to get the treatment all the time right away. So what can you do if tantrums and frustrations in nonverbal children? And it just has 4 big areas that you can help the parent know how to take the next step. And again, like to Sonia's other resource identified, communication is probably a big reason they're having some of the meltdowns. So kind of like, okay, let's identify the patterns. Let's use multiple methods of communication. And that's sometimes new to parents, especially if they have another child that's completely verbal with no communication challenges. Clarity and clear communication, and it just a reminder, remaining calm and mindful of your tone, and then that consistency and carryover. I think, you know, our role in such a complex initial situation where the child has been referred to 5 different specialists essentially is saying, okay, we're obviously going to work with the child, but that's not going to change things tomorrow. But here's some things you could start doing today to start moving the needle to where it's a more functional way to communicate at home. So, yeah.
Yeah, I find like in evaluations, parents want like, what can I do until therapy starts, you know, and talk about the journey and everything, what they can do at home. Megan, can you go back to the case study quickly? Yeah. I know we're going to wrap up here. Just ABA. I feel like we could have a whole episode on that. I don't know what y'all's thoughts are. I feel like anytime I talk about ABA, I come from a standpoint of just emotions and anecdotes and not like facts. I feel like I don't have a good knowledge base of ABA. I don't know what you all have seen in your practice, but I just feel like sometimes it's a little bit intense. I don't know how appropriate it is all the time. And the clinic that I was in a different state, it just tended to get just handed out. Like it was for, you know, everyone with ASD needed ABA. So if you want to share your thoughts.
So I like that you just said that. So I don't like that many people try to just push this approach on anyone who's diagnosed with autism. That's the issue I have. Whether or not it works for children, that's specific to the child. Just like I said, there's no cookie cut approach to treatment, to intervention, to strategies we use. I think there's no cookie cut approach to systems of treatment that we use with children. I would tell this family, so it says the parents were hesitant, the parents are saying they're hesitant about this approach. I would tell them, like I believe Heidi mentioned in our last show, do your own research. It's good to get input from families who've been through things, but your child is a different child. They're their own being. They come with their own upbringing, their own culture, their own level of performance. I would say do your research, see what's out there on it from like a research perspective. Talk to a clinician who does this approach. Go to the center, see what they offer. See if it's possible for you to do a trial, if that's something that you're open to. But I would never say to only base it on someone else's experience, because your child is not that person's child. So again, whether or not it works for everyone, I don't know. I do work with a lot of children who are diagnosed with autism, and a good percentage of them are using ABA, and another percentage are not using ABA. Some parents love it. They talk highly about it. They absolutely are happy for it. Some are begging to get it. They can't get it. Others just hate it. So I think it's very specific to the child and how they're performing and what their individual needs are.
Well said, Sonia.
I can't, yeah, that's all I would say. For the child, and there's not, yeah, I've seen all 3 scenarios, like yes, no, maybe.
That's also a great way to put it, honestly. Well, let's wrap up, y'all. Thank you both so much for your time and sharing all of those different perspectives. It's really helpful to know how to use our resources in a bunch of different ways and the versatility of all of them. So thank you everyone for listening in. We can't wait to gather next month for another show to talk about our next collection of resources. And we want to thank all you therapists out there for making therapy informative, empowering, and person-centered. Thank you all. See you next time.